Can you go into a little bit more detail? You sort of touched on it at the end there, but how Australian companies can get involved with their research or as a supplier or an innovator, and also any gaps you're aware of that are remaining to be addressed they could jump in on and support.
Absolutely. So what I love about working in Australia is the tremendous innovation that's going on. And so I know of a lot of health sensing companies, and keep thinking about breaking down the barriers between health and medical. So if you're involved in companies doing health sensing, make sure they're building those sensors to the highest standard so we can trust the data in a medical environment. We have to stop categorizing these separately. We need to drive harder to build to the highest quality and reliability and use validation along the way to do that. But there are also some phenomenal integration platforms that are coming out of Australia. I mean, some of our best remote devices like the Cardia, the 6-lead EKG, many of the technologies that we're deploying in remote care have come out of Australia because there's a need, but there's an innovation community that's being really expanded by your group. There are huge opportunities in the Australian Space Agency. They are really fueling. There are great funding opportunities. So make sure you're looking at the Australian Space Agency website. And then NASA and the ASA have made really good combined efforts to fund innovation in health technology. And then also look at what's happening in the AAD, because that's another analog that you have right in your own country that should be explored. I'm really happy to talk to anybody who's interested in this kind of work. The gaps are, as I outlined, we need better gauges for people. We need to empower people better. We need to break through the barriers that have been artificially set up between health and medical so that our bodies move back and forth between conditions, so do our devices and our data.